Hey parents, I wanted to come on here real quick with Dr. Amara just to give you a few tips around nutrition and some ABA therapy tips that you can implement during the holiday season. And we know it's a time for family bonding and lots of joy. And we also know that it can also feel a little overwhelming when you're a parent of a child who's neurodivergent. And so we just wanted to come on here and share a few tips to help make things a little smoother, more joyful, and less stressful for you this holiday season. So, Dr. Mara, please introduce yourself.
Hello, parents. My name is Dr. Mara. I am a pediatric health coach and I'm also an ABA therapist. So I know that this is holiday season, so we're just here to share some tips, and I look forward to.
Yeah, I'm not sure what just happened, but that's okay. So, Dr. Mara, before we came on here, we were chatting about just easy strategies for parents that they can implement at home to help continue the process or continue what has been taught in ABA therapy with their children right now that
Yes.
there's no longer therapy going on at this point. So, what are a couple of those strategies that parents can implement that will help?
Okay, so I would say that I know that for the most part, having worked in a clinic, during the holiday period, there may not be, you may not have access to therapy. So I would say that before your child's last day at therapy, please speak to the BCBA or speak to the speech therapist and find out what the goal they've been working on, and that could be something you can implement at home. So I would say for the holiday season, you can have a goal. And one of the strategies that you would learn if you join the Nourish and Communicate program, one of the strategies we teach is we teach naturalistic strategies. So, and this is you creating a natural communicative atmosphere for your child to communicate at home. So one of the things you can do is have a goal. So it could be you want your child to learn how to request more. It could be you want your child to respond to questions more often. It could be you want them to be able to express their needs and wants. So just have one goal. And I speak to parents often, and it's like you have so many things. But now look at your child's daily routine for the next 1 or 2 weeks during the holiday and just have one goal. So it can be every day I want, for example, John to be able to, tell me I want milk. Or if your child is nonverbal, the goal would be they're able to point using their index finger, or they're able to show you what the item is. So we don't want them to grab your hands and take you to where it is. We want them to be able to point, or make a gesture, or use a multi-mode approach to communicating. So like I said, have one goal, and that goal could be every day I want him to be able to request for breakfast, lunch, and dinner, or at least, one of the meals he's going to have every day. Now, I hear this from parents a lot, and they're like, I know what he wants to eat. I know what he likes eating. So I have it ready even before he comes down. So we're going to do things a little bit differently this holiday. You would have him make that choice. So that goes back to the goal you have. So let's say, for example, you are a parent and your goal for John, for example, is I want John to be able to request for his needs and his wants, also all these things that he needs. So and one of the things he will need every day is breakfast, lunch, dinner. Those are major needs. So rather than making sure that is available, or setting the table up like we'd always do as moms, we would want John to, make a choice. So, and it could be very easy. If he would have juice, for example, he likes apple juice in the afternoon with his lunch. Rather than, bringing the apple juice, you can bring apple juice, chocolate milk, and maybe water, and have him tell you what do you, and you can ask him, what do you want, and have him make that choice. So you would do that across 2 or 3 opportunities every day. So that is you being able to have a goal to get your child communicating. Another thing you can do is involve them. So this is holiday season. There'll be lots of cooking. I am very sure, especially from next week, there'll be lots of cookings. There'll be lots of shopping. and I can agree it's very stressful to take a child out, but maybe one of the shoppings you can have them go and make a choice of something, or have them choose their gifts, or have them choose something, but trying to involve them in what's going on, having them have that sense of involvement. So you can have them make choices, you can have them participate in whatever that is going on. Please do not try to seclude them. Have them be with other families, be with other friends, and be with other family members. Okay. And then the final thing here is modeling. So this, you want to make sure you are demonstrating the behavior you want to see them implement this holiday. So teach them a lot of saying, okay, if you want this, say I want, or if you want this point, if you want this, use your speech device, if for those of them using an AAC device. But model a lot, show them what you want them to do rather than having that expectation. Okay, I know I said so much, but yes.
Oh my goodness. No, that was so wonderful. I think as a summary, it's have one goal, not 10
Just
goals.
one
Have
goal.
one goal
Yes, just one goal.
and model the behavior you want to see.
Exactly.
Maybe 2 or 3 times a day,
Mhm.
and just be intentional about it. And the thing is, as the child repeats a behavior or repeats a gesture or repeats the words, then that creates a path in their brain, right? And then that becomes a habit. So yes, all for parents creating new helpful habits
That's
this holiday season. That was really good. And so we're gonna switch gears slightly and talk about nutrition, because for us at Glow Pediatrics, we have to talk about both things.
both sides.
Nutrition is key to how the brain functions, and while we are gonna add in the ABA therapy, we need to make sure our brains are working well. So what are a couple of nutrition tips that I would like to share with parents as they shop or as they cook this holiday season?
So I would say we'll have to start from the grocery store. That is where it all begins. So I know we have this in depth in our program, Dr. Echo, right? Yeah, we have it. If you join the program, you would learn a lot about understanding the grocery store, being able to identify ingredients that are harmful to your child, being able to know better options. I always tell parents that for every bad option, there is a better option. So we don't have to lose heart. There are still companies out there that prioritize our but first of all, it starts with a grocery store. If it's in your pantry, there's a high chance that you bought it in the store, right? So it starts from the grocery store, and I want you, as much as you can, it's not going to be perfect, but I would always push for the 70-30 approach, where 70% of the time you are doing the best you can, and 30% of the time you're leaving it to human errors and uncertainty, right? So, but with a child with autism, we want to still be intentional. We do not want to blow up their bodies because it's holiday season. So now I just came in from the store, and it's all green and red everywhere. So it's green in the cookies, you're seeing green cakes, red cupcakes, it's green and red everywhere. But please, parents, I want us to be very intentional with what you're buying. Have you know that for the most part, those green and reds are artificial dyes, and they are very, very harmful to your child's health. So we still will want to, I would personally, encourage that you keep these treats to a minimum. Better still, you can make yours at home. You can use spirulina powder as your own green color. You can use beetroot for red color. You can use turmeric for yellow color. And those are real food ingredients. So make yours at home. You would have a huge control over what your child is consuming. And I would say exchange those sweets for fruits and vegetables, for fruits. So if you wanted to give your child ice cream, you can definitely make yours at home, using yogurt, making it into a popsicle. But the overall goal is not that, your child is exempted. But I mean, what would you be enjoying if in the long run, all you get is your child being hyper, their gut being imbalanced, and you are starting in January and the whole stress is, I personally would not do that. I'm also, being very mindful even with my kid at home. So I would say be very mindful of what your child is buying. be very mindful of what you're buying and what they are buying as well. This is not a time for them to consume too many treats or sugars. Be mindful of added sugars. I would always say for children with autism and even for children in general, keep added sugar to zero, and all forms of sugar, dextrose, sucrose, and all the lows, please, those are still sugars. So please just keep sugars to zero and just utilize. There are lots of products out there that have natural sugar. So if you join the Nourish and Communicate program, the Glow Nourish and Communicate program, we have a full guide that we're currently working on right now that just shows you everything you need to get from the grocery store. So you don't need to ask, is this correct? We're already doing the research for you to know the right foods your child should have in the grocery store. So, but please, it starts from the grocery store. It starts from the grocery store to your pantry. Avoid seed oils. Those oils are not good for your child's gut health and even for you as well, not just for the child. So that's something you may want to consider. So I would say just keep everything in moderation, but for the most part, you can eliminate them and look for better options.
Yes. And the seed oils you're referring to are things like
Canola oil, vegetable oil,
oils, yes.
soybean oil, grapeseed oils, sunflower oils. Those are very, very, those are hydrogenated and they are not good. Yeah.
Okay, so some good oils would be like avocado oil that has a high smoke point.
Coconut
oil is great as well. Ghee, what we're discussing about ghee is great as well. So yeah, so we just wanted to come on here and encourage you. And you mentioned several times the Nourish and Communicate group that we have at Glow Pediatrics. Would you like to tell
and
them?
just to add, this is, I know this may be out of it, but this is not a time for them to be on the screen. That I know it's a lot of Christmas movies, but remember that the screen is also too much of it is not really very good for their brain functioning. So I would say you have lots of activities planned out. I was just sitting down yesterday and talking through things I would do for the holiday, like going to see the lights, going to see nature and all of that. So because if you're only watching Christmas songs and Christmas, that's not really good. So, and also sleep. Please allow them sleep as much as they can. It's also very good. Yeah. Okay. You're talking about the nourishing
No, that's okay. Of course, it's important to maintain routines as much as possible.
Oh, yes. Oh, yes.
I mean, January is around the corner, back to school and all of that. So it's important to maintain sleep routines, daily routines as much as possible. So yes, back to the Nourish and Communicate group. So it's a group program we started at Glow Pediatrics where we're going to be teaching parents how to communicate better with their children at home, and also how to improve their nutrition, their gut health, which affects their brain health at home. So we're combining the two together into it's an amazing program, if I say so myself, where we're going to be working alongside parents, just teaching them practical strategies they can fit into their daily lives. It's not about overwhelm. It's just about what are the things that you need to change that will move the needle in terms of your child's sleep, behavior, overall functioning, so that they can do better in 2025. Do you have anything you'd like to add?
Yes, I would say just like what Dr. Ekwa said, it's an intensive program. So whether your child has received a diagnosis or they are still yet to receive, this program would definitely be a huge source. It would be a huge resource to you because you would learn and know what is going on. So I know sometimes you get the diagnosis and all you know is your child is showing some behaviors, they're not talking, but you will get to understand why this is going on and what you can do at home. It's good to have good providers. I would never take that away. It's good to have therapy like ABA therapy going on. I'm also an ABA therapist. I would never take I would not take that away. But it's much better if you yourself, as the parent, is empowered to do, because when you after seeing the doctor, you still come back home to yourself. When your child closes from therapy, they come back home. Now it's holiday season, they are back home. So you would not have the therapist, you will not have Dr. Eko, who is a pediatrician for children with autism. You will never have her. She also will have to be with family. So I would really encourage that you use this to educate and empower yourself. And you will literally have hands-on, done-for-you resources. So like we talked about the grocery store guide, that is a must for every parent or every parent of a child with autism, because there are lots of foods that the child is consuming that is impacting brain health and gut health. So you want to first of all at least give yourself that gift in the new year, that I would be more intentional with what my child is eating, and I'll make more better decisions. And the truth is, I've noticed this with parents we have worked with over time, that when you in your mind you're trying to improve your child's nutrition, but what you don't see is you're improving your entire household's nutrition. It has happened to me when I began, walking around nutrition for my son. I found myself eating the same foods, right? So you would not want to cook, 5 different meals. So as you improve the nutrition for your child, you're also going to be doing the same thing for yourself, and you without knowing. So you will get practical guides for the grocery store. You will get gut healing recipes. You will learn how to detox your child. We get that question a lot. We were talking about that, I think, 2 weeks ago. That parents ask, how do I detox? I don't encourage those sprays. I know I see them a lot online. Those spray detox, that's a cheap, and I'll call it a harmful way to detox your child. The best way to detox is through nutrient dense foods and intentional supplementation, because you're giving the body, you're nourishing the body, at the same time you're empowering the body to remove the toxins that I need. So you will learn a lot more when you come in, but we look forward to having you there. We're starting in January, and Dr. Iko will share some details.
Yes, wonderful. So we hope that these tips have been helpful to you and your family as you go into the holiday. Remember, it's all about joy, and we're wishing you a joyful season with your precious kids and a less stressful one. So take care and
Thank you.
the
Bye
next time, and please keep following us for more tips,
bye.
and we'll see you soon.
Thank you. Bye bye.
Bye.